Actually, I want to play this sound because I think this is an interesting example related to what you're talking about. Maybe you should put on the headphones for that, or I guess you can play it on speaker. Okay. Bernie Sanders had a very successful night at this Fox News town hall, and it's interesting because I mean, look, obviously, he's running on, he's not running on a full democratization of the workplace. No. But there are these kind of sparks and shoots of, as an example, healthcare, of actually a little bit more of the dynamic you're talking about, which is like, how about we just stop the bullshit? And here was a great example of this and the audience and their feedback to this proposal on Fox. And I'd like to get your thoughts after we play it.
This audience has a lot of Democrats in it. It has Republicans, independents, Democratic Socialists, conservatives. I want to ask the audience a question. If you could raise your hand here. A show of hands of how many people get their insurance from work, private insurance, right now. How many get it from private insurance? Okay. Now, of those, how many are willing to transition to what the senator says, a government-run system? There's 180 million people on private insurance.
All right, let's deal with that, Brett.
And
fair question.
They would be lost, right? To your
Brett,
system.
Fair
okay.
question.
Okay.
Question.
Good, thank you.
I know it's what the right wing throws out, so let me answer it. All right? Millions of people every single year lose their health insurance. You know why? They get fired or they quit and they go to another employer. I was the mayor for 8 years. You know what I did, what probably every mayor in America does? Is you look around for the best insurance program, the most cost-effective insurance. You change insurance. Every year, millions of workers wake up in the morning and their employer has changed the insurance that they have. Maybe they like the doctors. People are nodding their heads. Okay, so this is not new. Every year. Now, what we're talking about actually is stability. That when you have a Medicare for all, it is there now and it will be there in the future.
That's some degree of what you're talking about.
Absolutely. I mean, it's literally the same as the segment went over. You could have someone explain to us that for the early history of capitalism, wherever it settled in as the dominant system, employees didn't get health insurance. They got a salary or a wage, and that was it. Workers had to fight, and a long time and very difficult, before they got things we now call benefits, one of which is health insurance. No sooner did they get health insurance over the objection of the business community than the business community went to work to undo what they had lost, the struggle to avoid it. Okay, now you have it. So what do? To this day, they bargain over the coverage. You will get covered for this illness, not that one. This prior condition, not that one. As soon as that struggle is a little bit underway, they hit you with another one. You'll now have to have a copay. When you go to the doctor or the hospital, you're going to have to kick in. Well, it's a little bit at first to get you over the hump, $5, $10, but then it goes to $20, and then the $30, and then the $50, and then we have the deductibles, the first umpteen dollars you can't recover. I mean, it's endless. And then if they can, they weasel out of it one way or another. So as Bernie says, to have a private insurance is no security at all. And the double irony is you had to fight for that. And so now we see the effort to go a bit further, and the same forces are trying to prevent it in order not to lose control. Why do they want the control? Well, Bernie just explained it, because they can then bargain each year and nickel and dime you out of the support you're supposed to get. It's endless, and it will continue to be endless. Even if we get what Bernie wants, there will be one effort after another then to lower, to water down whatever the national health insurance covers. And if you don't want to believe me, just take a look in England, where the Conservatives have been working for the last 10 years to undo the National Health Service there, which is a major struggle and has the same breakdown between the left wing behind Jeremy Corbyn, sort of England's Bernie, that we see here. And literally, it's our future.
You've just watched a Michael Brooks show video, and you can watch all of our full main live shows every Tuesday night at around 7 p.m. Eastern Time, and subscribe to get all of the clips you want. We're covering the globe. We're focusing on international relations, the intellectual dark web. We're having fun. We're doing deep dives. with a lot of amazing guests. Of course, become a patron for the whole thing at patreon.com/TMBS, or subscribe to this YouTube channel and help us keep growing and get that content out there. Subscribe below.